It's August 6th, and we have a lot to talk about. But before we get into today's episode, I want to take a moment to remember June Halper, the founder and CEO of the Consortium of Multiple Sclerosis Centers, who passed away on July 24th. June was truly a force in the evolution of MS care. She was a certified adult nurse practitioner who specialized in multiple sclerosis. And in 1978, June founded the MS Center in Teaneck, New Jersey. Now keep in mind, this was a full 15 years before there were any approved disease-modifying therapies to treat MS. June was a founding director of the International Organization of MS Nurses. She was inducted as a fellow into the American Academy of Nursing in November 1999, and in 2004, as executive director of the Consortium of MS Centers, June initiated the first certification exam for multidisciplinary MS specialist. But beyond the dozens of publications she authored, beyond pioneering so much of what's taken for granted today as MS nursing care, June was known for her compassion, her joy of life, her boundless generosity, and her spirit of adventure. June loved music and she loved to travel. Over her lifetime, she observed 14 total solar eclipses all around the world. It's an understatement to say that June has left a void in the MS community. She will truly be missed. Integrative medicine brings conventional and complementary treatments together in a coordinated way. This type of approach to health and wellness represents a growing trend across the United States, especially among people who live with a chronic disease like MS. Joining me to discuss what integrative medicine is and how to safely integrate complementary treatments as part of your MS care is Dr. Lynne Shinto, a professor in the Department of Neurology at Oregon Health and Science University. But before we get to my conversation with Dr. Shinto, there are a few other things that you should know about. If you're like most people, you may not think that common infections, like a cold, the flu, or a urinary tract infection, contribute to MS worsening. But recently published results of a study partially funded by the MS Society in the UK might require us to reconsider how these everyday infections may actually impact progressive MS. In multiple sclerosis, inflammation in the central nervous system leads to myelin damage, and that demyelination is what causes MS symptoms or disability to develop. Over time, this progressive damage and loss of nerve cells causes people living with MS to experience atrophy in parts of the central nervous system. The results of this study show that people with progressive MS who experienced more infections outside of the central nervous system, infections from a common cold or the flu or a UTI, for example, well, they also experienced a greater amount of atrophy within their central nervous system. This study followed 50 participants. 28 participants were living with primary progressive MS, and 22 participants were living with secondary progressive MS. These 50 participants had been living with MS for about 12 years, and 3/4 of them needed assistance walking. The study participants were followed for an average of 2.6 years, and during that time they submitted weekly urine samples that were tested for biomarkers of inflammation that was occurring outside the central nervous system. The study participants were also given routine MRI scans to measure brain and spinal cord atrophy. An analysis of the study data revealed that those study participants who had increased systemic inflammation also had increased spinal cord atrophy. So the takeaway here is that people living with progressive MS might want to take steps to minimize inflammation when they can. That means getting all of the standard recommended vaccinations, seeking prompt medical attention for bladder infections, and making healthy lifestyle choices, because factors like smoking, alcohol, and obesity are all linked to inflammation. These study results show that by staying healthy in general, you're also taking steps to manage progressive MS by minimizing the potential for infections to develop outside the central nervous system that can lead to damage inside the central nervous system. And if you'd like to review the details of this study, you'll find that link in today's show notes. If you asked me to name a single technology that's poised to become a massive game changer in MS research and treatment, my answer would be artificial intelligence. And recently published results of a study by a team of researchers in Italy, Spain, Canada, Switzerland, Australia, Turkey, Belgium, the Netherlands, and Kuwait offer a glimpse at how AI can make a difference in treating MS. From the moment someone is diagnosed with MS, they find themselves living with the uncertainty of not knowing whether or when their disease is likely to progress and their symptoms to worsen. This study analyzed data from over 15,000 adults who had at least a 3-year history of MS. These patients were treated at 146 different MS centers located in 40 different countries. And the research team used this vast amount of data to train machine learning models to predict the likelihood of future disability progression. It turned out that these machine learning models were able to reliably predict disability progression over the next 2 years. The machine learning algorithm also discovered that an individual's past disability progression was a stronger predictor of future progression than their treatment or their relapse history. And this AI model doesn't require the patient to undergo any complicated or invasive tests. It relies on routinely collected clinical data, which means that it can be put to work in virtually any MS center. And by providing accurate predictions about future progression, this AI tool can help neurologists make more informed treatment decisions and assist patients in planning for their future, rather than wondering what that future might be like. Hopefully, these machine learning algorithms will be tested next in a real-world MS clinic, and when that happens, I promise you'll be among the first to know. If you'd like to review the details of this study, you'll find a link in today's show notes. Neurologists and neuro-ophthalmologists will tell you that the eyes are the windows into your central nervous system. MS usually causes some amount of damage to cells in the eyes, and a growing body of research suggests that analyzing those eye-related changes can help diagnose MS. Two of the tools that are used to analyze those eye-related changes are optical coherence tomography, or OCT, and infrared scanning laser ophthalmoscopy, or IRSLO. The retina is a region at the back of the eyeball that contains light-sensing cells. IRSLO is an imaging technique that uses a laser to create a two-dimensional image of the retina itself, while OCT generates a two-dimensional picture of the retinal layers. A research team in Iran applied machine learning to IRSLO scans to determine whether this AI model could identify MS. The researchers obtained IRSLO scans from 32 people with MS and 70 people who didn't have MS. All of these study participants were from Iran, and a subset of these scans was used to train the AI model. The remaining scans were used to test the AI model. And the AI model was able to identify just over 83% of the patients with MS and just over 85% of the patients who did not have MS. Similar tests using OCT produced slightly better results. But when the research team tested the AI model using both IRSLO and OCT, the AI model was accurate 96.6% of the time. Next, the researchers tested their AI model on an external data set of IRSLO and OCT scans from people in the United States, and the AI model was accurate in identifying 97.3% of the people with MS and 84.6% of the people who didn't have MS. I think we'll be hearing much more about the use of retinal imaging in the diagnosis of MS in the not-too-distant future, But this study is one more example of an automated and precise method of diagnosing MS that's low cost, non-invasive, and easily accessible. If you'd like to review the details of this study, you'll find a link in today's show notes. It seems that the world is pretty fast when it comes to implementing the latest and greatest emerging technology. But as a society, we're usually pretty slow to implement rules to help manage that technology. Social media is a fairly recent example of a technology that's been used to successfully mitigate feelings of social isolation and loneliness, but without any guardrails in place, it's also been used to try to undermine our elections. And since we were just talking about implementing artificial intelligence in healthcare, it seems like the ideal time to tell you that this past week, the European Union's AI Act went into effect. Now, the EU AI Act outlines regulations for the development, market placement, implementation, and use of artificial intelligence throughout the European Union. The AI Act specifically addresses what it identifies as high-risk use cases of AI, including implementing AI into medical devices, using AI to determine access to healthcare, using AI for biometric identification, and implementing AI into any form of processing personal data. When it comes to healthcare, the AI Act calls out using AI to determine whether an individual should have access to what are identified as essential public and private services, such as healthcare in the cases of maternity, industrial accidents, illness, loss of employment, dependency, or old age, as well as social and housing assistance, as all of these would be classified as high risk. When it comes to processing personal health data, I'll quote from the AI Act here. The European health data space will facilitate non-discriminatory access to health data and the training of AI algorithms on those data sets in a privacy-preserving, secure, timely, transparent, and trustworthy manner, and with an appropriate institutional governance, end quote. Now, when it comes to testing high-risk AI systems, companies must test them in real-world conditions and obtain informed consent from the participants. Companies are also required to eliminate or reduce the risk of bias in their AI applications and address bias when it occurs with specific mitigation measures. The European Union also makes clear that these regulations are not designed to stifle innovation. I'll quote directly from the new law here. This regulation should support innovation, should respect freedom of science, and should not undermine research and development activity. It is therefore necessary to exclude from its scope AI systems and models specifically developed and put into service for the sole purpose of scientific research and development. Moreover, it is necessary to ensure that this regulation does not otherwise affect scientific research and development activity on AI systems or models prior to being placed on the market or put into service. End quote. What we're seeing is the European Union putting speed limits into place before we have cars zooming up and down the highways at breakneck speed. Hopefully, the EU AI Act does what it's intended to do: protect the public by providing reasonable guardrails without stifling scientific discovery and innovation. It's going to be interesting to see if, when, and how the United States decides to tackle this same question. We've spent a good part of today's episode focused on emerging advanced technologies. At the same time, we live in a world where many people are pumping the brakes on the number of pills or prescription medications that they're taking. Instead, they're looking for complementary MS treatments that can be combined with conventional treatments. And that's what integrative medicine is all about. In a moment, we'll meet my guest, integrative medicine expert, Dr. Lynne Shinto. Integrative medicine brings conventional and complementary treatments together in a coordinated way. This type of approach to health and wellness represents a growing trend across the United States, especially among people living with a chronic disease like multiple sclerosis. Joining me to discuss what integrative medicine is and how to safely use complementary treatments as part of your MS care is Dr. Lynne Shinto. Dr. Shinto is a professor in the Department of Neurology at Oregon Health and Science University, where her research focus is on complementary, alternative, and integrative medicine. Welcome to the podcast, Dr. Shinto.
Thank you, John. It's a pleasure to be here.
I'm hoping you can start us off by clarifying what the terms complementary, alternative, and integrative mean. I've seen or heard these terms used interchangeably, but they don't really mean the same thing, do they?
No, they don't. So, complementary means non-conventional with conventional. For example, vitamin D with an MS disease-modifying therapy would be an example of a complementary therapy with vitamin D. Alternative means non-conventional or in place of the conventional. So using the same example, if you use vitamin D in place of an MS-DMT, the vitamin D would be considered alternative. Integrative would be similar to complementary. It's using both non-conventional and conventional medicine. So complementary with conventional medicine. So that again, the vitamin D with MS-DMT would be integrative medicine. And most people use integrative medicine or complementary medicine. I think people who use alternative, it's very few.
How are complementary and alternative medicine different from what we consider conventional medicine?
So I think the first thing is there's less scientific evidence for evaluating complementary alternative medicine, or we say CAM, than in conventional medicine. So it's harder for providers and for patients to know what the evidence base for effectiveness and safety is for CAM therapies. FDA regulates conventional drugs, and there's like the FDA indications, say for a disease modifier, that's an on-label drug for MS. But with a lot of dietary supplements, it's not regulated in the same way. There's a Dietary Supplement Health and Education Act of 1994, or the DSHEA Act, which is a law that regulates dietary supplements. Now, having said that, dietary supplements are placed in a different category from food and drugs by the FDA. It allows supplements to be marketed without pre-approval from the FDA, as long as they do not claim to diagnose, treat, cure, or prevent disease. For example, for vitamin D, if the company was marketing it to treat MS, that could not be on the market. The FDA does regulate in that way. But vitamin D can be on the market for general wellness. It's not treating, it's not a disease, it's just general wellness. And that is how these dietary supplements can be on the market without rigorous clinical trial or FDA surveillance. However, DSHEA does have some ways to protect the public from dietary supplements that are unsafe. So DSHEA gives the FDA authority to remove unsafe dietary supplements from the market. For example, ephedra, which is an herbal drug that was used in the 1990s, early 2000s for energy and weight loss. Well, it was linked with serious side effects that include heart attacks and death. And the FDA removed ephedra from the market, and it is no longer allowed to be sold on the market. So that would be an example of a dietary supplement that the FDA does have authority to remove because of bad side effects.
Well, I appreciate your example of using vitamin D along with a disease-modifying therapy. Can you share some other examples of common integrative health approaches for treating MS?
Yes. So I think common integrative health approaches used by people with MS are yoga, mindfulness or breathwork techniques. Specific diets are used often, like the Swank or Wahls diet. And people with MS often use these therapies with DMT or with other symptomatic, drug management therapies. And they seem to be.
According to the National Center for Complementary and Integrative Health, about 37% of U.S. adults use some form of integrative medicine. Why do you suppose there's so much interest in this approach to healthcare?
I think there's a big interest in wellness and focusing more on wellness than on disease. I also think that people are very interested in a holistic approach. So, in the traditional conventional treated disease or symptom model, you're just focusing on kind of the bad stuff, what's wrong. But I think what complementary alternative medicine offers is kind of looking at the positive side. How can we make people feel better? How can we improve wellness? How can we look at the whole body and see where we can make the whole body better? And the whole body would improve mind, body, and spirit. So it's really this holistic approach that is very appealing. Also, in this approach, there's a lot of empowerment. I mean, if you're using a diet or if you're doing yoga or Tai Chi or some physical movement like that, you are in charge. You are doing it. You don't need a doctor to tell you to do yoga. You can do yoga. You're in the driver's seat. And I think this empowerment piece is also very appealing for many people.
Let's talk about a few of the most common MS symptoms. We know that about half the people living with MS will experience some sort of cognitive decline. Are there integrative therapies designed to help someone maintain their brain health and prevent future cognitive dysfunction?
Sure. I hear this a lot about wanting to address brain health in MS. And for me, the pillars are healthy, nutrient-dense diet, physical movement, and stress reduction. So whether the stress reduction is movement or exercise, or whether it's some other, technique like breathing or mindfulness, I think we also need to realize that stress does affect the brain, especially in MS. It can affect the brain, and having a good stress reduction technique or therapy in conjunction with diet and movement is going to help with brain health.
Fatigue may be the most common MS symptom, and it's a symptom for which there are no effective treatments in conventional medicine. Is there an integrative medicine approach to managing MS-related fatigue?
Yes. So again, I'm going back to diet. I just think diet and food is so powerful. I mean, food is medicine, and food can be not great too if you're, drinking sodas and having too much sugar and processed food in your diet. That's like kind of bad medicine. But there have been several studies looking at different diets for MS fatigue. One of them is the Overcoming MS diet, which is dairy-free. It's red meat-free, no chicken, no egg yolks. It's a whole foods diet, low or no processed foods that includes sugar. It's basically a very healthy diet. And there has been a study showing that people on this diet have decreased fatigue. There's also the Wahls, and this is diet, which is a modified paleo diet. So in some ways, it's a little bit opposite of the Overcoming MS diet in that you can eat red meat. But there actually is no dairy in the Wahls diet. And the Wahls diet, again, is low or no processed foods, whole grains, lots of vegetables. There's like 9 servings of vegetables in the Wahls diet. So it's a very nutrient-dense, healthy diet. And then there's also the low saturated fat diet. So that would be less than 15 grams of saturated fat. So that's like butter kind of fat, or the fat you see in a steak. That fat, we're not talking about oils. And so that diet also has shown decreased fatigue on people with MS who are following that diet. So diet, I think, has the best evidence of the integrative medicine therapies to help with MS fatigue.
And what about pain or spasticity? Can integrative medicine help manage these two very common symptoms?
Sure. So one thing I like to recommend is acupuncture for pain and spasticity. The evidence for acupuncture and spasticity is not strong at all, but for pain in general, there's a lot of evidence for low back pain in people in general. Not specifically for MS, but it's very effective in different types of pain, even headache. So I usually like to recommend acupuncture therapy for pain. The other great thing about acupuncture is, they use these very fine needles, so you're not taking a biologic, like as in a dietary supplement. So there's less concern about interaction with other medications. And it's been used for a long time. There have been many studies in low back pain. It's a pretty safe therapy.
It's important to find a medical specialist who's been trained and is qualified to treat others. What's the best way for someone to find an integrative medicine provider who's an accredited specialist?
So there are state and national licensing boards, and that's probably the best place to look. Acupuncturists, and I'm a naturopath. Our states, like in Oregon, where I am, you can plug in the name and it will tell you whether the person's licensed or not. A lot of medical schools and hospitals now have integrative medicine centers, and the integrative medicine centers really vet their providers. So there are acupuncturists, chiropractors, sometimes functional medicine doctors, sometimes naturopaths in these centers. And these folks will already have they're licensed and trained, and they often require a minimum amount of years of seeing patients for clinical competency. So that's another way to make sure you're seeing an accredited specialist. And also your medical provider. You can ask them, your PCP or someone you're seeing for even PT, if you're going to a physical therapist, they may know of a licensed integrative medicine provider that they feel comfortable with and will recommend. So these are ways to find out if a provider is accredited.
Well, Dr. Lynne Shinto, I want to thank you for all you do to improve the lives of people who are living with MS. And thanks so much for talking with me today.
Thank you, John. It was really a pleasure.
That's going to wrap up this episode of Real Talk MS. Real Talk MS is powered by the National MS Society. And you can share this episode of the podcast by letting your friends or family members know that all they have to do is point their web browser at realtalkms.com/362. You'll find that link in today's show notes, so you can easily copy and paste it right into an email or a text. And if you have a minute, I hope you'll pay a visit to the Apple App Store or the Google Play Store and download the free Real Talk MS app for your iOS or Android smartphone or tablet. It's the best way for us to stay connected. The app will automatically download the latest episode of Real Talk MS. You'll be able to access any of our past episodes. You'll be able to save your favorite episodes. And it's a great way for me to share bonus content with you. The app is free, so I hope you'll download it today. I'm John Strum. Thanks for listening. Stay safe and make healthy choices.